I'm Doug from the Wellness Dentistry Network, and I have this special feature tonight that we want to do with a guest, Dr. Todd Lapine. Dr. Lapine is part of our Partners in Health portion of the Wellness Dentistry Network, and Todd is just a wealth of knowledge. So, Todd, welcome. I appreciate you coming on and spending a few minutes with me.
Sure. Well, thank you for inviting me, Doug. I'm excited tonight. It's as most people out there on Mondays tend to be sort of busy days, but I'm always excited when I talk about the oral health systemic connection. I think it's so important, and hopefully the listeners out there will gather some pearls and take home some good clinical information to bring back to their practices.
Yeah, I appreciate that. And I wanted to make sure that on the right of the screen, Todd, everybody knows in our network that you're available to help us. You can, when you look under services available, you can do telemedicine consultations. You've been courteous enough to put fees down there. I know fees are subject to change. So if anybody has any concerns, they could reach out to you or email you because you're very good with email and responding. So I appreciate that.
Sure, no problem.
Todd, what the intention of tonight is and what the intention of our talk is and what we're going to be doing tonight is up on the top of the screen on the right-hand side, you'll see the dashboard when you go into the Wellness Dentistry Network. And there's many different aspects of the dashboard. There's two that I would point out. One is the Office Forms Library, which my mouse is going around right now. And this is where the dental tools are all stored, where we make lots and lots of tools for people. And then I'd like to build out this medical professionals toolbox as well. So hopefully I can reach out to some professionals like you and start putting things in, even from medical professionals. We do have some medical professional members and some nurse practitioners, not many. Most of those folks are partners in health, and they're just helping out, and there's no fee involved for that. In the Partners in Health box, this is where we find your full listing. So if people want to get a hold of you or know more about that, they can do that. But what I wanted to focus on tonight was to look at, if you click on and if you go into the Office Forms Dental Library and you open it up, there's all these topic areas, 23 different topic areas. And Todd, what I wanted to get from you was just an off-the-cuff, unrehearsed gut response about what we can do together as a dentist and physician and how we can work through some of these things. And the first 8 of these are really related to dentistry. And I know you do some things with oral microbiome, and you do some things that are even you think would be dental related. So I want to talk a little bit about that, but then I want to get your opinion about how we can best help our patients in the rest of the areas. So here's the nidus for why we built the Wellness Dentistry Network and where we're going with this. Number one, we need to teach each other. So I appreciate you taking the time to help me learn and help our network learn. And then this 2012 study talks about how 72% of our patients see us regularly versus 52% that see you guys. So what it means is 27 million people will be seen only by a dentist next year. And if dentists had a keen awareness about how oral conditions affect systemic health, maybe they could do more. Maybe we could get more people your way. Maybe we could work with medical professionals in a different way, and we could help more people. Because the question that I asked myself was, how much of this undiagnosed prediabetes, diabetes, apnea, insulin resistance, all these things, how much is really out there? And I think you'd probably say a lot, right?
Absolutely a lot. Yeah, there's, that's the whole thing is, I think, it's very much the same in dentistry and medicine is the earlier you can catch a condition or a quote unquote disease, the easier it is to turn around and to treat. And, rather than waiting for someone to have frank, diabetes or frank heart disease,
yeah.
You want to be catching them preemptively. And there are definitely ways of asking the right questions, gathering the clinical information, getting pertinent lab tests that really allow you to, see what's underneath the surface.
Yeah, and that's really nice because you basically just outlined kind of what I'm looking for. You said when I look at the modules that I'm trying to coach dentists to learn about and physicians to consider taking referrals from us to help with, it is what are the right questions that we have to ask, and if there is a pertinent lab to that section, could we get it, and is it out of our scope to get it, and how is it related? So that's perfect, a perfect intro. And then this 2014 study suggests there is significant medical cost savings if we take care of the mouth. And this particular study focused on periodontal disease. It didn't. It looks at periodontal disease, and we know periodontal disease and sleep apnea are probably the two huge disease entities that really carry us to a lot of other places in the mouth to work through. So, Todd, most of the rest of this talk is going to be dialogue because I just want to expand the library so we can all see it. And I kind of wanted to go through and talk about this. All of us have intake forms, a clinical wellness exam. If you thought, Todd, there was some kind of nice generic intake form that I could put into the physician toolbox or a history and physical in the functional medicine world, the way we do it, even if it's lengthy, I would love to have it to share with our medical professionals. We have a standardized exam process that we go through in dentistry where we evaluate all these 8 areas. And Todd, you've been kind enough to actually refer some patients to me from Massachusetts to and that live anywhere in the world to my office in Bloomfield Hills. And when we do that, we go through each one of these areas, and I give you a summary report on my findings in at least these areas. And then this number 9 and below is kind of your expertise. And so this is where I want to get help. You don't have to make a commitment, but this is something that I really would like to build out on because I don't know what questions the physicians ask on typical intake forms.
Right. Yeah. I mean, I would say that there's really, there are many different kinds of intake forms that are out there, and it really depends upon what you're seeking to get. You can get a variety of different. I mean, some of the intake forms, in my opinion, are so lengthy that patients sort of they lose interest in trying to fill them out. So I think that intake forms tend to be better when they're really to the point and concise, as opposed to having something that checking every box and crossing every T and dotting every I, that kind of a thing.
Okay. And then in the world of gum disease, this is where we spend a lot of our education time, and we're going to be, we work a lot in this area. And you actually order some oral DNA testing, I think yourself, don't you?
Absolutely. Yeah. I actually, just for those who don't know my background is that I come from a family of dentists. My grandfather was a dentist and my father was a dentist. My older brother is a dentist, and he's got 2 sons who are dentists early in practice. And I have 2 sisters who are dental hygienists. So I'm the sort of the black sheep of the family. And I got interested in dentistry just by virtue of being in my family. And the more I practiced regular medicine and then transitioned over to integrative functional medicine, I really saw the connection. It just, the light bulb went on in my brain. I'll never forget, I had this is one of those anecdotal stories. And this is before I really got real deep into the oral microbiome. I had this old patient of mine, and he was probably in his late 70s, early 80s, thereabouts, and he was a sort of a farmer type guy. And I remember distinctly him telling me that he said, whenever my joints are bad, all he does is he uses Listerine. And when he used Listerine, he said that it helped with his joints. And I said, how can Listerine, help joint pain? Because I wasn't trained to think that way. But only later on did I realize that what he was probably doing is he was killing off some of the oral pathological
pathogens, organisms,
and he was getting some temporary relief from systemic inflammation. And it was sort of like an interesting awakening, and sort of a eureka moment where I really saw the oral systemic connection. But getting to the testing, I do the oral DNA test to check for the various pathogens that can be found in the mouth that are associated with periodontal disease. And I find that to be a very helpful test when I have a patient that I'm concerned about oral dysbiosis.
Yep, and I'll introduce you to another one, Todd, that we have. It's called PhytoLab. It's a newer one, 29 pathogens, and it looks at cumulative bacterial load. And so we'll expand and grow in that area a little bit. I'm working with a company right now, but it's pretty interesting.
Yeah. The one thing that I thought was nice in terms of recently, I don't know if you've seen the new report with the the oral DNAs, they sort of link up which organisms are associated with which type of health conditions, and they
Yes, on page 2, it's quite nice.
I think they did a nice job there, and I think that format, no matter which lab, is a good format to really sort of show you how all these different pathogens can be associated with rheumatoid arthritis or heart disease or diabetes or obesity, etc.
Yeah, it's great. Todd, do you do anything with cavities? Do you do any look at any kind of cavity bacteria or
That I don't. I mean, if I see obvious cavities, I'll refer someone to a dentist. I mean, my biggest thing with cavities is really getting people to get off of refined carbohydrates and sugars. Because a lot of people, it's interesting because they think, well, they're not eating a lot of sugars, but if you are eating refined carbs like rice crackers and pretzels and things like that, those things immediately get turned into sugars.
Sure.
In the mouth. So I try to, get people to better understand how their diet plays a huge role, not only with their waistline, but also with their oral health, which in turn is associated with their systemic health.
Sure. We also have there is a study that strep mutans also embeds itself in the wall of the atheroma, or in the wall of the vessel. So strep mutans is another traveling part of the microbiome that that affects heart disease as well.
And there's a there's multiple organisms that they've seen in atherosclerotic plaques, and they associate with a whole variety of different pathogens. But you're absolutely right. Some of the oral microbes are the ones that really want to be on your radar.
Yeah, so the idea behind us having and the idea for treatment for us for cavities is that we want to take a multi-pronged approach to the disease. It's not just dietary management, but it's pH change, adding an antimicrobial, adding fluoride if people will accept it. Or where are you at with fluoride, Todd? Do you use it? Do you not use it? Do you not recommend it? Where are you at?
You bring up a very interesting question, and also the biggest question is how does fluoride actually work? Does fluoride work as really a topical antibiotic, or is it actually getting the fluoride also getting into the hydroxyapatite matrix?
Yeah, it hardens the tooth by getting into the matrix. There is some bacterial static kind of properties to it, but probably not. It is one of the halogen. It is one of the halides. So there's something to it, but nothing like iodine and chlorine and some of the other halides.
Yeah. So I think like anything, I think that the poison is in the dose, if you will.
Yeah.
So too little may be bad, and too much may be bad. So I think that there's definitely a lot of studies have shown that fluoride, when it gets incorporated into the hydroxyapatite, that it does form more resistant enamel, and makes it less susceptible to cavities, for sure.
Yeah, you bet. And then these biocorrosion or environmental conditions, what we're concerned about in dentistry is abrasion and erosion. Those are the two big things. So erosion could be from intrinsically, from acids from the stomach, or it could be from extrinsic sources like dietary issues, citrus, or in the different acids, citric acid, phosphoric acid, carbonic acid.
Yep.
The different acids that chelate minerals out of the teeth, out of the tooth surfaces, and create softening. So that's what that topic is for us. And we, a lot of people have these notches around the next to the teeth, and they can be very sensitive.
Yeah. I mean, I always tell patients, if you want to get some rust off of something, use Coca-Cola because it's full of phosphoric acid.
That's it.
It'll take anything off.
And then we focus on bite disease. Obviously, you need good teeth to eat good food. We have to have that. So we do a little bit with bite disease and joint issues, but not too much here in the WDN. Most of our understanding of occlusion and how teeth fit together comes out of our restorative continuums and our other education sources. Oral cancer is a big. Oh, go ahead.
No, I was going to say there's one device which I learned about through my brother, who's a dentist. It's called it's a a bite device called the NTI. Have you ever heard of it?
I have, yep. Well, most of us dentists have heard of these types of things that that prevent clenching, right, and grinding.
Yeah, and it can be very helpful for people with TMJ and people also with migraines. And my brother has had some pretty good success with it.
Yep.
And my understanding of it is it sort of puts the TMJ joint in the muscle sort of like in neutral. So it sort of parks it in neutral so that you're not clenching, and it can really make a big difference in those people who are unconscious clenchers and teeth grinders and such. And a physician's assistant who I worked with, who was having really bad headaches and migraines and just a whole bunch of things, and she was trying all kinds of stuff, seeing dentists and you name it. And when I first learned about it, I said, "Why don't you look into it?" And so lo and behold, she did, and she's completely fine now.
Yeah, I like your description actually, talking about putting, from a simplistic standpoint of view, putting your muscles in neutral and putting your, kind of your jaw joint in neutral.
Yep.
is kind of cool. And we know that just like your patient intake forms, there's no one appliance that's the best for everybody. And so dentists need to be armed to know how to make several of these types of appliances. Both,
right.
So that's kind of where we're at with that.
Yeah.
Oral cancer, Todd, the big thing that we have now is we do have saliva tests for HPV. Hopefully you know about that, but the saliva test for HPV, and, it's on the rise, and these HPV cancers are showing up deep in the throat where you can't really see them. So we're basically counseling people that if they have chronic ear pain or if they have hoarseness, sore throat, ringing in the ears, some of these things they want to go and get checked out for, for HPV. But we do have some saliva tests that actually give us virus copies and speciates the virus. So we're also seeing cancers that are not from the typical HPV 16 and 18. Do you administer the vaccine to children?
I do not do the vaccine to children. I actually don't treat children.
Okay.
Although I'll tell you, I'm very leery about the HPV vaccination because in certain susceptible individuals, it can trigger significant autoimmune conditions. And also in young adolescent women, it's been actually known to cause permanent infertility. So there's a double-edged sword with I think the HPV vaccine that people need to be aware of. And it's not widely known, but if you look into the medical literature on it, there are, side effects. So like anything has its risks versus its benefits. And which is a whole topic unto itself, which is, how do vaccines affect our immune system, and there's a good number of evidence that some of the adjuncts, not necessarily the antigens in the vaccine, but some of the adjuncts, specifically aluminum, in some of the vaccinations have been known to trigger autoimmune conditions. So, from a personal standpoint, I don't see children, so I don't give the HPV vaccine, but I have seen probably a handful of patients who have had problems related to the HPV vaccine. So I'm a little bit leery about it. Yeah.
That's good for us to think about because we're recommending it, but we don't, we're obviously we don't have that information. So that's helpful.
Yeah.
Airway and breathing, sleep apnea. Do you do home sleep testing or how do you?
I basically, if I see any patient who's feeling tired, I'll always ask them about their snoring and their sleep, or their spouse, significant other. Sometimes they don't know that they snore. It's one of those I call it low hanging fruit.
Yeah.
Don't think that the patient has to be overweight to. I always tell other doctors who I lecture to, you don't think that the patient just has to be overweight to have problems with sleep apnea or disordered breathing. Because you can see people who are relatively skinny and just maybe related to their the oropharyngeal anatomy. So definitely, I will refer patients for sleep studies, and I typically also for mild to moderate patients with sleep apnea, I have found that the oral appliances can actually be very effective and sometimes can mitigate the need for the sleep machines because they're a lot more cumbersome, and a lot of patients find them uncomfortable, and they don't really like them, so they're less likely to use them. But for more severe cases, the sleep apnea machines are definitely the way to go.
Yeah, we have several experts actually in the WDN that are dentists that are experts in airway and breathing disordered sleep, airway management. And so it's really nice to, we have, a couple guys who've invented appliances. And so we do use these things, and we do recommend a thorough sleep evaluation. And some of it's just our understanding of the anatomy, tongue ties and some of that kind of stuff. But we could, both an airway and heart, with many of these topics, we could go on and on for a long time. But I just want to get the concept of this is just to get some general comments about each one of these modules. Yeah. And then appearance. The reason why we have appearance in this is because of just the psychological impact of somebody having low self-esteem and not being accepted, maybe being bullied. These things happen when these kids, young adults, have deformed teeth, and then of course when adults have that too, it affects their social.
Yeah, absolutely. You bring up an interesting point, and that if somebody has unsightly teeth and they literally aren't exposing their teeth and they're not smiling, over time, if you don't smile, you'll actually be more prone towards depression. There's been studies showing that just the act of putting the facial muscles into a smile will tell the brain that the person's happy, and they'll, if you will, get their happy juices flowing. And if you don't smile or if you frown, you'll actually start feeling more depressed. So I think that's a really important aspect.
Yeah, I didn't know about that particular study, so that's good information for us. That's interesting. So so thank you for that. Mm-hmm. So now heart disease and brain health. This is now where we start in your area of expertise, because I know that you do cognitive assessments. Before we get to the heart disease, Todd, how do you you do MOCA? Do you do some kind of online assessment? How do you evaluate cognition?
Yeah, the MOCA, which is the Montreal Cognitive Assessment, that's sort of almost like a gold standard, I would say, for doing assessment and monitoring patients. So that's one way of doing it. Oftentimes when patients are coming in, it depends on where they are on the spectrum. They may have a little bit of very mild cognitive decline, and the question is this sort of like natural age related, or is this the beginning signs of some dementia or Alzheimer's? And there's definitely, it was just in the news in the last 6 months, the connection between porphyromonas gingivalis and Alzheimer's. And the whole immune system and the vascular system are all interconnected. And I think some of the other oral organisms have been also associated, some of the treponema bacteria have been associated with higher risk for Alzheimer's. So definitely, it needs to be on everyone's radar. And so if anybody who is coming in with me with memory issues or whatever, I'm going to be doing oral assessment and oral microbiome assessment to see what's going on there.
Yeah, that's great, because we do know that all these studies are showing anything that affects the vascular biology is going to have a brain effect and, of course, a heart effect. I mean, we have 60,000 miles of blood vessels that service two huge organs, plus many others, but our heart and our brain. Do you think that a dentist could a dentist do the Montreal assessment as a early assessment to help someone realize if they needed to be referred?
Yeah, absolutely. I mean, the dentist could do it himself or have an assistant do it. It's a pretty simple test. You can get trained in. I think they have the group that does it. They have a training session for it, so you know how to use it appropriately. But it's pretty straightforward. Back in the old days, we used to have what was called the mini mental status, which was another way of assessing cognitive health, but now it's been more standardized, and the MOCA is sort of the gold standard. But yeah, definitely a dentist or assistant to the dentist could do that easily.
Yep. Okay, and then heart disease. I think it's the same thing as brain health. We want to have some kind of assessment. So I would imagine you're probably looking at advanced lipid labs, or are you looking at some imaging?
Oh yeah, absolutely. I mean, I oftentimes will, I always tell patients I really don't even ever order, a standard lipid profile because it's really almost worthless. Heart disease is really related to inflammation, and it's related to a person's diet, their oral microbiome, and their gut microbiome. So you've got to look at the whole big picture. And some of the more advanced lipid testing that I'll do the NMR lipo profile, which breaks down the lipids into the particle size, particle number. Yep. And LabCorp does a really nice graphical chart for that, and they show you your risk value. And at the end, they come up with what's called the lipoprotein insulin resistance score, which is really telling you where you are on the spectrum of prediabetes or diabetes. So I find that to be very helpful. And then I really combine that with a high sensitivity C-reactive protein, which in fact has really been shown to be more effective at predicting heart disease than an LDL cholesterol. And then I'll throw in things like F2 isoprostanes and oxidized LDL, or I tell my patients rusty cholesterol. Those are adjunctive things that I'll do for assessing a person's risk for heart disease. And then if someone has a really strong family history, sometimes I'll also do lipoprotein little a, which is an independent risk factor for heart disease. And if that's elevated, those are people who are at much higher risk than the average person, even if they have a sort of a borderline or average cholesterol level.
Yeah, we feel so strongly about the tie between oral health and the medical biomarkers that are related to cardiovascular health that we have an agreement with Cleveland Heart Lab that WDN members can any WDN member can order an inflammatory panel. We have a preset inflammatory panel from Cleveland Heart Lab, and it's quite inexpensive. It's a cash price, and it gives us a lot of information about how somebody with bad oral health could be. They could also have high inflammatory markers, which would mean we'd really want to get them to you before we started to do our work.
Right.
So that we could get the patient a little more stabilized. So you could it wouldn't be odd for you in the future if you got referrals from a WDN member. It could come with some basic labs. You'd have to augment them again, but we would do that. We would do that as screening.
Sure.